First of all, we will talk about cold sores. Next slide. Okay, so what are cold sores? They are a viral infection. They are tiny fluid-filled blisters on and around your lips. Basically, a virus that attacks the skin near your lips. A scab forms that can last several days. Cold sores usually heal in 2 to 3 weeks without leaving a scar. Cold sores spread from person to person by close contact. They're usually caused by herpes simplex virus type 1 and less commonly by herpes simplex virus type 2. And does anybody know why they're called cold sores? Why cold? Let's say. So basically, usually in the cold, your lips get dry and crusty and open up a bit, so that leaves room for infections such as the cold sores virus, herpes simplex virus. So that's one of the things. And the usual way of transmission for this virus is through close contact. Usually the main type is it's usually when kissing. This is the closest contact that will go. I think that's it. Yeah. Next slide. Okay, so how does it form, and what are the stages of this cold sore? At first, that you will feel a little bit of itching. Many people feel itching, burning, or tingling around the lips for a day or so. Before a small, hard, painful spot appears and blisters erupt. So first of all, it starts burning a bit, starts itching, and then slowly it will bulk up and the blister will form. Small, fluid-filled blisters typically erupt along the borders of the lips. Sometimes they appear around the nose, cheeks, or inside of the mouth. So, as you see in the pictures, at first it's itching, then it starts to have the blisters erupt, and then slowly it crusts up, and the skin crusts up and becomes more of a جرح. ما ادري بس بالانجليزي بس انه جرح, and starts crusting. The small blisters may emerge and then burst, leaving a yellow, shallow, open sore that oozes and crusts over. So these are the stages of the blister. Right, next slide. Okay, first outbreak symptoms, not systems. What? Why? I have a question, and why do these symptoms only emerge in the first outbreak of the virus? Does anyone know, or would anybody like to have a guess?
What's the question again?
Why do these symptoms only appear in the first outbreak of the virus? Come on.
I'm not really sure.
Well, let's say, for example, the COVID vaccine, and how they give you a weaker form of the virus, so you get used to it. So your immune system knows how to deal with it. At first, when this foreign virus comes in, your immune system is trying to fight it off. So it's not used to it. So what happens is you get these symptoms of your immune system and your antigens defending the body. But then what happens is after the first outbreak, these symptoms don't usually appear because your immune system knows how to deal with this virus and has the antibodies to attack it. So that's why in the first outbreak, there's these specific symptoms that happen that are symptoms of the immune system rather than the virus itself. So these symptoms are fever, painful gums, sore throat, headache, muscle ache, and swollen lymph nodes. So usually for any viral attack, first outbreak of any viral attack, um, these symptoms will appear, and cold sores is not an exception. Next slide. Went to see a doctor. Cold sores generally clear up after treatment. Usually, um,
Uh,
usually, oh, go
Sorry
ahead.
for interrupting, but I joined a little late. What's the lesson today?
Cold sores.
Okay, thank you.
Um, to recap, cold sores is a viral infection near the mouth. For you, Yusuf. Um,
Oh, I see.
Usually, cold sores generally clear up without symptoms, without treatment. It's like any normal. Um, so it just clears up normally. There's no need for treatment. But there are severe cases and some cases that need treatment. Um, these cases are a weakened immune system, and your body cannot fight off the virus, and it spreads uncontrollably to the point where it gets in the blood and can cause all types of problems. Um, the cold sore doesn't heal up in time, which also probably because you have a weakened immune system. This is another case, or any other problem. If the cold sore doesn't go within 2 weeks, there's a problem and you need to get treatment. Um, if the symptoms are severe, um, for an example, let's say the cold sores go all around your mouth and it's a lot of them to the point that you need to get treatment quickly because it's too much. Um, a frequent recurrence of cold sores it happens, let's say, every month you get a cold sore, and that at that point you need treatment. You experience irritation in your eyes. All right. And is this also me? Okay. Um, what causes these cold sores in the first place? Um, well, basically, it's caused by it's a viral attack. The HSV1, the herpes, usually causes these cold sores. Ways of transmission are through close contact, um, such as kissing. Um, Cold sores are most dangerous when you have oozing blisters because the virus easily spreads through contact with infected fluid. So the it's more prone to spreading when the virus is at the stage in the middle, in which it's still a fluid. The sore did not, the blister did not crust up yet. That's when it's more able to be transmitted. Other ways it can be transmitted if you share utensils, toothbrush, razors, anything that you put on your face, and you share it with another person. There's an ability that a person places the virus in the thing that you're sharing, and then you use it, so you get infected. That's these are some of the ways that um that it can be spread, such as spoons, towels, brushes, um, shaving machines, anything that you share. Yeah, that's it. I don't know that. Okay.
Uh,
Once you've
okay, let me do this. There is an episode of herpes infection. Herpes is an infection that's caused by herpes simplex virus or HSV. Oral herpes causes cold sores around the mouth or face. However, once you've had an episode of herpes infection, the virus lies dormant in nerve cells in your skin and may emerge as another cold sore at the same place as before. Recurrence may be triggered by viral infection or fever, hormonal changes such as those related to menstruation, stress, fatigue, exposure to sunlight and wind, changes in the immune system, and injury in the skin. Almost everyone is at risk of cold sores. Most adults carry the virus that causes cold sores even if they've never had symptoms. If you have a weakened immune system, you're at most risk of complications from the virus. Cold sores generally clear up without treatment in 2 to 4 weeks. Several types of prescription antiviral medications may speed the healing process, such as antiviral medication as aciclovir, valociclovir, famiciclovir, and penciclovir. Try other cold sore remedies. Some over-the-counter preparation contain a drying agent, such as alcohol, that may speed healing. Use lip balms and cream. Protect your lips from the sun with a zinc oxide cream or lip balm with sunblock. If your lips become dry, apply moisturizing cream. Apply a compress. A cold, damp cloth may reduce redness, help remove crusting, and promote healing. Or try a warm compress to the blisters to ease pain. Rest and try pain relievers. Take over-the-counter pain relievers if you have a fever or the cold sore is painful. Creams with iodine or benzocaine may offer some pain relief.